The next patient, you can see his hand here, is a gentleman in his late 40s who had a Russian blue as a cat pet. And his cat became frightened when it saw a dog one night and scratched him, as you can see, on his hand and forearm, and also bit him over his hand as well. Now, he cleaned his hand very well the first evening and thought that everything was going to be fine. Over the next 8 to 12 hours, his hand became swollen and painful, and then he presented to our clinic in the early afternoon the following day. Now, if you look, these photographs were taken in the clinic before we admitted him to the hospital. So if you look a little closer, you can see that the index finger is quite swollen and actually was very painful. And you can see the puncture marks on his hand where the cat bit into his skin. And there's actually some serosanguinous drainage coming through, and you can see a little closer, easier on the closer view here. This patient required admission to the hospital. We obtained a surgical consultation. He did not have to go to surgery, and actually he recovered over the next 12 to 24 hours and was able to go home with oral antibiotics after a couple days of IV therapy. So you can see cat bites can be quite devastating, and certainly with hand infections, there's potential for severe problems if they're not aggressively treated. Now, the pathogens usually involved with cat bites are aerobic and anaerobic bacteria. The gram-positives are generally Staphylococcus, Strep, and diphtheroids. The gram-negatives, Fusobacterium, Echinella, and also Pasteurella. We'll talk more about Pasteurella because it's a really bad player. Pasteurella is a small, non-motile, gram-negative coccobacillus. It's a very aggressive pathogen, and infections with this bacteria tend to advance very rapidly. And there's severe inflammation, purulent drainage at the bite site, and patients often will have a really rapid course if this bacteria is involved with their infection. Now, when to begin antibiotics? That's always a question. With human bites, it's basically mandatory. If a human bites you or you get in a bar fight and strike somebody, you need to be placed on antibiotics because very likely to become infected. Cat bites, most sources would also start antibiotics after a cat bite, simply because of the high risk of infection, and as we talked about, especially the hands. Other factors influencing whether to begin prophylactic antibiotics if a patient presents to you following a cat bite would involve the severity of the injury itself, any potential for bone or joint involvement, and also any comorbid conditions the patient has, such as severe immunocompromised state or other medical problems that might lead to severe infection complications. And just again to review, this is a photograph of a cat. You get a good idea that the pincer-like quality of the cat's teeth. And so if they bite into you, there's a good chance it's going to go deep into your skin and introduce significant bacteria into your system. Now, antibiotic coverage, don't wait for culture results. Start empiric therapy. And generally, if the patient is able to take penicillin, you can use amoxicillin, clavulanate, or ampicillin sulbactam. Now, dicloxacillin, erythromycin, and cephalexin really have poor activity against Pasteurella. And also you need anaerobic coverage also for Pasteurella. Now, in patients who have a penicillin allergy, you want to use doxycycline, trimethoprim, sulfamethoxazole, or possibly a fluoroquinolone and clindamycin. Clindamycin has rather poor activity against Pasteurella, but you do need it for other organisms because, again, frequently these are multi-organism infections that result from cat bites.